everyone, welcome to TriRide. This is Pack 365, myself Srija. So today in this session, you're going to learn about the ICD-10-CM coding guidelines for disease of eye and adnexa. So in ICD-10-CM, the diseases of eye and adnexa are classified under Chapter 7. So in this, H00 to H59 is a series for the disease of the eye and adnexa. So what is the first guideline? Glaucoma. So glaucoma is coded in ICD-10-CM category H40. So this includes various types of glaucoma. Coding glaucoma requires you to identify the type of glaucoma, which eye is affected, and the stage of the glaucoma. So how do you code glaucoma? So what are the specific guidelines to code these? So first is assigning glaucoma codes. So the guideline says assign as many codes for category H40 glaucoma as needed to identify the type of glaucoma, the affected eye, and the glaucoma stage. So what does it mean? The glaucoma codes in ICD-10-CM are very specific. So each code must tell three things. The type of glaucoma, whether it is a primary open angle glaucoma, whether it's a primary angle closure, whether it's a glaucoma secondary to eye trauma, or glaucoma secondary to drugs. And the second thing is laterality. Laterality means which side of the eye is affected. 1 for right eye, 2 for left eye, 3 for bilateral, and we give 9 for unspecified eye. And the third one is the stage of glaucoma. Nothing but it's a 7th character. So we assign 0 stage for the stage unspecified, 1 for mild stage, 2 for moderate stage, and 3 for severe stage, whereas 4 for indeterminate stage. So why it is important? So glaucoma can progress differently in each eye. So one eye may be mild, the other may be severe. Therefore, you must code each eye separately if the type of stage differs. So this is about the first guideline. Second guideline, bilateral glaucoma with the same type and stage. So this guideline states, in the case A, there is a specific code for bilateral glaucoma. So when the patient has bilateral glaucoma with the same type and stage and there is a bilateral code, you have to report only one code. For example, if the documentation gives the primary open angle glaucoma and it is a bilateral and it is in a moderate stage. So there is a code which exists for this bilateral, right? You have to assign H40.1132. So this is for this we assign for primary open angle glaucoma, bilateral and moderate stage. So only one code is required. You should not code two, you should not give two codes. Only one code for bilateral is enough. So in the case B, there is no specific bilateral code available. So the guideline says whenever there is no specific code for bilateral glaucoma such as H40.10 or H40.20, report only one code using the 7th character for the stage. Example, some subcategories in H40 do not provide bilateral options in their structure. Whereas H40.10, which is an unspecified open angle glaucoma. So these have only right and left, right? Unspecified means it's not bilateral. So what is the coding rule over here? You have to still report one code only. You have to choose laterality as the bilateral is not needed because the guideline instructs not to assign two separate codes. For example, when the documentation is given as unspecified open angle glaucoma, bilateral and mild stage. So there is no bilateral code exists in the category H40.10. So what is the correct coding? H40.10x1, which is given for unspecified open angle glaucoma with the mild stage. So even though the eye is bilateral, the ICD-10-CM instructs you to assign only one code. So why this rule exists? Because bilateral glaucoma is common and the ICD-10-CM wants to avoid the duplicate reporting whenever both eyes have same type and same stage. So if they differ, you must code separately. Okay, so this is about the guideline, mainly about how to assign glaucoma codes and how to assign the bilateral glaucoma if there is a same type and same stage. So in the next slide, this is a third guideline. What is it? Bilateral glaucoma stage with different types or stages. So this section explains what to do when each eye is not the same. Either the type of glaucoma differs or the stage differs. So this rule depends on whether ICD-10-CM allows laterality in the glaucoma category. So what does this guideline tell you? If the classification ICD-10-CM code set it supports the laterality, you must code each eye separately whenever the eyes are not the same. For example, if the documentation gave you right eye, which is a primary open angle glaucoma and in mild stage, you have to assign one code for this. Whereas for the left eye, there is a primary open angle glaucoma severe stage. You have to code the another code for this. So because the stage differs, you must report both the codes separately. So what is the key concept here? When right eye is not similar to left eye, then two codes must be assigned. So if each eye has a different type and the category does not support laterality, then how would you code it? If isolate in categories that do not support laterality, which include H40.10 and H40.20. So you have to assign one code for each type of glaucoma with the proper 7th character for the stage. So what does this guideline tells you? Some glaucoma categories have no right, left or bilateral choices. So in these cases, you cannot code per eye, but you still must report both the types. So for example, if the documentation gave you right eye unspecified open angle glaucoma moderate stage, then you have to code H40.10x2. Whereas for the left eye unspecified angle closure glaucoma, it is in the mild stage, then you have to assign H40.20x1. So these categories they do not allow laterality, but types are different. So you have to assign two separate codes, one for each type. So if laterality is not available but the types differ, you have to code each type once, adding the correct 7th character. So this is the key concept for this guideline. So what happens if each eye has the same type but different stages and laterality is not provided? You have to assign a code for the type of glaucoma for each eye with the 7th character for the specific stage. So even when the type is the same, if the stage differs, you must still assign two codes because ICD-10-CM requires the stage level accuracy. But because there is no laterality code format, you simply assign one code for the type with stage for I1 and another code for the type with stage for I2. So what is the example over here? If there is a right eye with unspecified open angle glaucoma in the mild stage, you have to assign the code H40.10x1. Whereas in the left eye, if there is an unspecified open angle glaucoma with the severe stage, you have to assign code H40.10x3. So even though the type is same, the stage is not same, right? You have to code two. You have to assign two codes. So what is the key concept here? If laterality is not supported, then the same type but different stage, you have to still give two codes. So this is a third guideline under glaucoma. So what is the fourth guideline? So if the patient is admitted with glaucoma and the stage progresses during the admission, so you have to assign the code for the highest stage documented. So what does it mean? Sometimes a patient is admitted with a certain glaucoma stage and the disease worsens during the hospitalization. So the ICD-10-CM wants you to code the most severe stage that occurred during the stay, but not on the stage of the admission. So for example, if during the admission, it was a primary open angle glaucoma in the mild stage, which is a stage 1, and during hospital stage, it progresses to moderate stage. Then what you have to assign? You have to assign only the moderate stage code, but not the mild stage code. So why you have to code only the moderate stage code? Because the code must reflect the highest severity reached because that represents the true clinical condition managed during the admission. So this is about the fourth guideline. So coming to fifth guideline, indeterminate stage glaucoma. So assign 7th character 4 for indeterminate stage if clinically documented that the stage cannot be determined. So indeterminate stage is used only when the physician specifically indicates the glaucoma cannot be staged or staging is not possible due to the clinical reasons. For example, it may be due to dense corneal opacity, maybe inability to visualize the optic nerve. So this is not the same as unspecified. So you should not confuse between indeterminate versus unspecified. So seventh character 4 for indeterminate stage. You have to use whenever the stage cannot be determined based on the clinical examination. So physician documents the stage indeterminate, cannot determine stage or unstageable. So seventh character 0, it indicates the unspecified stage. So whenever this documentation does not mention the stage at all, or the clinician did not record any stage, or else there is no specific information regarding the stage. So you have to assign the seventh character as 0, which indicates unspecified. So this is the difference between the indeterminate stage and unspecified stage. So next, coming to the blindness guideline. So if blindness or low vision of both the eyes is documented, but the specific visual impairment category is not documented, you have to assign H54.3 unqualified visual loss both eyes. So what does it mean? Whenever the visual impairment categories ranging from 1 to 5 are often needed for the precise blindness coding. So but if the documentation only says patient is blind in both eyes or low vision in the both eyes, so without specifying the category of the visual impairment, you have to then use the H54.3 category code, which indicates the unqualified visual loss in the both eyes. For example, if the documentation says patient is completely blind in both eyes, then there is no mention of visual impairment classification. Then you have to assign the code H54.3. So if the documentation specifies the visual impairment category, like maybe a category 3, category 5, then you would choose a more specific H54 code instead of this H54.3. Okay. So next is the blindness or low vision in one eye. The category is not documented. So if blindness or low vision in one eye is not documented, but the visual impairment category is not documented, you have to assign a code from H54.6 unqualified visual loss in one eye. Nothing but if a physician clearly states that one eye only has the blindness or low vision, but does not provide the category like category 3, category 4, etc., then you must assign a code from H54.6, which indicates the unqualified visual loss for one eye. So this code range is used when the coder knows which eye is affected but doesn't know the severity category. Okay, so what is the example? If the documentation says the blindness in the right eye, then there is no category given. So how would you code it? You have to code H54.61 for unqualified visual loss in the right eye, because they had mentioned the right eye. They also mentioned the blindness, the visual loss, but they didn't mention the category. So it comes under the unqualified visual loss. So blindness must be linked to a specific eye for H54.6 category codes. So next, coming to, this is all about the guidelines of the ICD-10-CM guidelines of the disease of the eye and adnexa. Now let's discuss about the medical terminology for the disease of eye and adnexa. So root words, coming to root words, I already said you the brief discussion about root, prefix and suffix earlier. So these root words are the building blocks of the eye related medical terms. It helps you to understanding them easily, to recognize the disease location, the type of disorder, the anatomy involved and the related procedures. So below there is an expanded explanation of each root with the example. So coming to the first word, ophthalmo or oculo. So ophthalmo means, the meaning of this root word is eye. So this refers to the eye as whole. So for example, ophthalmology means the study of the eye. Then opto or optico, the meaning is vision. So these are related to vision or sight, but not the eye structure itself. For example, optometrist means, opto means vision. So specialist in the vision correction. Whereas blepharo means eyelid. So these are used for the disease and surgeries involving the eyelid. For example, blepharitis. So what do you mean by blepharitis? Inflammation of the eyelid. So next root word is conjunctivo. Conjunctivo is the root word for the meaning of conjunctiva. So conjunctiva is a thin membrane covering the white of the eye and inside of the eyelids. For example, conjunctivitis gives, what do you mean by conjunctivitis? It's the inflammation of the conjunctiva, nothing but a pink eye. So then corneo or kerato is the root word for cornea. So it refers to the clear front surface of the eye. For example, keratitis. So what do you mean by keratitis? The inflammation of the cornea. So next root word is irido or iri. The meaning is iris. Next is cyclo. Cyclo, the meaning is ciliary body. And choroido means choroid. Retino means retina. Lacrimo means tear apparatus. For tear apparatus, you have two root words, lacrimo or dacro, or lacrimal system. So it refers to the tear glands and tear drainage system. For example, dacrocystosis means infection of the tear sac. And then sclero is the root word for sclera. Phaco means lens. So these are some of the root words which are associated with the eye. So next, coming to prefixes. So prefixes are the words which are added before the root words to change their meaning. So understanding them, it helps to decode the medical terms very easily. So what is the first prefix? Epi. So what do you mean by epi? Above, on. So this is used whenever something is located on the surface or above another surface. For example, epidermis. Epidermis is a layer on the top of the dermis. So next prefix is endo. Endo, the meaning of endo is within. And hyper, excess. Hypo means below or deficient. Peri means around. Pan means all or entire. And pseudo means false. So these are some of the prefixes. So next, looking into suffixes. Itis. So suffixes, these are added at the end of the root words. So this describe the condition, disease or the procedure. So itis is nothing but inflammation. So these are used for any inflammatory disease. For example, conjunctivitis, keratitis, blepharitis. So next suffix is pati. Pati means disease condition. So pati is a general term for a disorder or a tissue of function. Example, if there is a retinopathy, it's a disease of the retina. And oma. The meaning of oma is tumor. So this indicates the mass, often but not always malignant. For example, if there is a melanoma, it's a malignant tumor of the melanocytes. And the opia or opsia suffix is the meaning visual condition. So this opia or opsia is used for describing the types of vision problems. For example, myopia means a nearsightedness or hyperopia means a farsightedness. So next suffixes are ptosis. Ptosis means a drooping. So drooping, what do you mean by drooping? It describes abnormal downward displacement. For example, blepharoptis means a drooping eyelid. So eyelid moving or turning downwards. So next suffix is spasm. What is the meaning of spasm? Involuntary contraction. Means a sudden repeated involuntary muscle movement. So tropia or phoria, it's a suffix of eye deviation. And odynia means a pain. For example, otodynia means ear pain. Ophthalmodynia means eye pain. So next suffix is lysis, nothing but loosening or destruction. So this refers to breaking down, dissolving or separating. So these are some of the roots, prefixes and suffixes associated with the eye and adnexa. So next, coming to detailed terminology of the diseases by structure. So blepharitis. Blepharitis, it's a chronic or acute inflammation of the eyelid margins, often due to bacteria, dandruff or the blocked glands. So what are the symptoms of the blepharitis? Burning, crusting, and the eyelids appear red in color. So next is chalazion. Chalazion, it is a chronic granulomatous inflammation which is caused by the blocked meibomian gland. So this is usually painless. It's a firm swelling on the eyelid. So next is entropion, is nothing but the inward turning eyelid, inward turning of the eyelid margin. So what are the risks of the entropion? Eyelashes rub the cornea, irritation, tearing, and also the potential corneal ulcers. So next is ectropion, outward turning eyelid. So what are the symptoms of ectropion? Excess tearing, dryness, irritation, and also poor eyelid closure. And conjunctivitis, which is the inflammation of the conjunctiva caused by infection, allergy, or chemicals. So maybe bacterial type by purulent discharge, viral, watery eyelids, or watery reddy eyes, and allergic itching plus tearing. So this is one of the most commonly coded eye diagnosis in ICD-10-CM. What it is? Conjunctivitis. So next is subconjunctival hemorrhage. So it is a bleeding below the conjunctiva. So what are the causes of the subconjunctival hemorrhage? Sneezing, coughing, straining, trauma, and also the hypertension. So next is dacrocystis. It's an infection of the lacrimal sac due to the duct obstruction. So what are the signs of the dacrocystis? Pain, swelling near the inner corner of the eye, excess tearing, and also possible discharge. So next is epiphora. Epiphora is nothing but it's an overflow tearing due to blocked tear drainage or excess tear production. So what are the causes of the epiphora? Nasolacrimal duct obstruction, ocular surface irritation, and also the ectropion or entropion. So this epiphora, it is always associated with the lacrimal duct obstruction codes. So next is keratoconus. So what is keratoconus? It's a progressive thinning and cone-shaped bulging of the cornea. So what are the effects of the keratoconus? Irregular astigmatism, distorted vision. This may require the cornea transplant in advanced stages. So this is keratoconus can mostly seen in the teenagers and also the younger adults. So keratopathy, it's a generic term meaning any disease of the cornea. So this is used whenever the exact type is not specified. And scleritis means it's a severe painful inflammation of the sclera. Sclera is the white outer layer, right? It's a white outer layer of the eye. So deep boring pain is the characteristic of the scleritis, and it is often the autoimmune disorder. So the scleritis, it is more serious than the episcleritis. And then it is uveitis. It's an inflammation of the uveal tract. So uveal tract, it includes iris, ciliary body, and also the choroid layer. So there are 4 types of uveitis: anterior uveitis, intermediate uveitis, and posterior and also panuveitis. So what are the symptoms of uveitis? Redness, pain, photophobia, and also the blurred vision. So next is choroiditis. It's inflammation of the choroid layer, the vascular layer behind the retina. So this choroiditis, it is seen mostly in the autoimmune diseases and also the infections. So aphakia, A means absence. So absence of the natural lens. So what are the causes of aphakia? Cataract surgery, the lens removed, trauma, and also congenital, which is a rare condition. So what is the effect of the aphakia? It's a severe refractive error. It results in special correction. So next is pseudophakia, presence of an artificial intraocular lens after the cataract surgery. So pseudophakia, it is one of the most common eye surgery findings. So next is vitreous humor. Vitreous humor means it's vitreous hemorrhage means hemorrhage is nothing but bleeding. So bleeding in the vitreous cavity. So what are the common causes of the vitreous hemorrhage? Diabetic retinopathy, retinal tears, trauma, and also the posterior vitreous detachment. So what are the symptoms of the diabetic retinopathy? Floaters, hazy vision, and red tint. So this is a retinal microvascular damage due to a long-standing diabetes. For example, NPDR, PDR, this may include the macular edema. So major cause of the blindness worldwide is the diabetic retinopathy. So next is hypertensive retinopathy. It is nothing but damage to the retinal blood vessels due to the chronic hypertension. So what are the signs? You can see the narrowed vessels, cotton wool spots, flame-shaped hemorrhages. So macular degeneration. Degeneration of the macula, the central part of the retina, which is responsible for the detailed vision. So there are 2 types of macular degeneration. dry AMD and wet AMD. So dry AMD is for the gradual loss and wet AMD, it's a rapid vision loss due to the neovascularization. So this macular degeneration, it is most common in the older adults which are age related. So retinoblastoma, it's a malignant retinal tumor occurring in the young children mostly. So key signs are this family history, maybe it is a genetic form, and strabismus, and also the leukocoria, nothing but the white pupil. So this is about the medical terminology of the diseases of eye and adnexa. So this is for today's guys. So I hope this session has helped you. So in the next session, you will be able to learn the coding classification, the ICD-10-CM coding classification for the disease of the eye and accessory structures. Thank you.